Okay, thank you very much. So good morning, everyone. I'm very happy to see you. I will be more happier to hear from you and to discuss case studies. And so I will start our meeting by a brief introduction to using BIOFOR products in the summertime and some tips how to use them safely without causing burns or pigmentation. So peeling is an important part of all kinds of treatment that we do in the clinic, not only anti-aging, but also acne and pigmentation and comedones and texture problems. And some cosmeticians and some doctors avoid in the summertime using peeling in order to prevent sensitivities and burns and pigmentation. But we have to remember that when we are doing aesthetics or cosmetics, it's not yes or no. We do or we not do peeling. It's which product, in which manner, which protocol for each and every client. Because we all have like a variety of clients. Some of them are very much exposed to the sun, and some of them are not, like from home to the office and coming back, and they are not exposed to the sun, and like a variety of amounts of sun exposure. So to each and every one, we should match the correct protocol with the correct product in order to be able to rejuvenate every one of them, or to continue treatments, not to stop acne treatments, not to stop, not to disturb the continuity of the pigmentation treatments or the acne treatment. It's very important to be able to treat all of our clients all around the year. So I would remind you the table that we have in the professional booklet, the table that helps you to decide according to the amount of sun exposure, which product and in which protocol should we give. So that's a very easy to use and useful table. And these are the guidelines actually. And now we will go through the kinds of treatments that we do and see how we manage giving treatment in the summertime. So let's start with the acne treatment. We use with most of the majority of the patients with acne, we use azelaic acid. And I want to remind that azelaic acid is safer than hydroxy acid when we speak about sun exposure, because hydroxy acid removes dead skin cells from the outermost layer of the skin. So we are more exposed to the sun and to burns and to pigmentation and so. But azelaic acid do not remove dead skin cells from the surface. It works from the inside. So it's safer than the hydroxy acids. And also it's anti-inflammatory and melanin suppressor. Some of the sun damages happen to the skin through inflammation and through free radicals that the sun rays spread on the skin. So azelaic acid is with the free radicals and the stress and the inflammation, we get pigmentation, and we get also signs of aging. Azelaic acid is also, by the way, antioxidant. It is anti-inflammatory and it is melanin suppressor. So it can combat those kinds of damages that the sun imposes on the skin. If you look at the product, we have Azelite, we have Azocare, we have Azelite Plus. Azocare and Azelite Plus are safer and you can use it almost regularly in the summertime. Azelite, because it can cause some irritation, so you should adapt the protocol according to the sun exposure, but the other two products are pretty safe to use in the summertime. With acne patients that tend to pigmentation, you can switch from enriched cream or from hydro, switch to light cream. Light cream, I will remind, is a moisturizing cream that contains, it's a moisturizer, but it contains 3 melanin inhibitors. So to protect all the clients that are prone to pigmentation, give them light cream, which is a very light and light texture or light consistency. Yeah, as for azopil, which is a peeling for the clinic, azopil also is safe for the summertime. Maybe for some patients you will do less application, but you definitely can use it in the summertime. Sometimes after azopil use, you could see a little bit of exacerbation of or a rush of new pimples, but it's temporarily and it will pass. It's natural, it will pass. If we speak about comedones, we tend to give bright or lactofil to comedone patients. On the summertime, you can do two things to protect them. You can give them less treatment days. Instead of every evening, you can give them like 3 days a week according to the sun exposure. Also, you can switch to a double pill or to lactofil plus, which are double products. Double pill and lactofil plus contain also melanin suppressors like skin tone. So they can protect our comedones clients when they are a little bit exposed to the sun and prevent pigmentation. Also for the client that have comedones and they have tendency to pigmentation, when they have red marks tend to become brown when they have tendency to pigmentation, and when they are exposed to the sun always amplifies the impact and the pigmentation. So if we have a client with red marks, if we usually give them only bright or only lactofil, in the summertime we can give them a double product, a double pill or lactofil plus, to protect from the sun exposure and to prevent the red marks from turning brown. And also for those same comedone clients, I will advise to give a light cream as a moisturizer to replace the regular moisturizer. This is an additional protection. Some of you doctors tend to give Renew to acne patients instead of Azalite, which is not a mistake. Sometimes it works very good. But remember, in the summertime, we are limited with the use of Renew because the Renew is the most photosensitive product when exposing to the sun. So avoid using a Renew for acne in the summertime and replace it with Azalite. So generally, the acne treatments won't change very much. The protocol will not change drastically because azelaic acid is pretty safe to use in the summertime. We can continue safely give treatment to all our acne patients with azelaic acid. The anti-aging treatments and the pigmentation treatments should have some changes. We will speak about it. But with the acne treatments, you're pretty safe to continue treating. Maybe some of the patients you will give less treatment days with Azalite and more melanin protection. So let's speak about treating pigmentation and signs of aging, like anti-aging treatment during the summertime. So I want to give you some tips of using the products safely and effectively. First, let me introduce an interesting clinical study that was done on azelaic acid pill, 20% azelaic acid pill, which normally we do. Most of these clinical studies are for a 20% azelaic acid pill for acne, but this study was for anti-aging. So I want to introduce it. So this clinical study that we can learn from it was conducted with like 30 women aged 52 to 70 something, like aging skin. And this was a series of treatment, 5 treatment in a series every 2 weeks with 20% azelaic acid. This was for rejuvenation, skin rejuvenation. And they noticed that the skin got better, but also the sebum secretion in the T-zone remained the same, but in the U-zone, there was a rise of the sebum secretion. which is very interesting because with age, the sebum secretion gets lower, right? This is one of the signs of aging. And for these women, there was a rise in the sebum secretion only in the U zone, not in the T zone. If I'm trying to think of a reason, because they didn't have the reason there, you know, azelaic acid is not really lowering the sebum secretion, but balancing. Balancing, it means when it's high, it will be lower. But when with age it gets lower, it will rise a little bit. So this is a good thing for our clients, you know, because we don't love dry skin. Another thing that the azelaic acid contributes to aging skin is that it normalizes the skin cells turnover. When we are young, you know, the skin cells are in line. And when you are young, it's very line and very orderly. Cells are very orderly, like doing the process of being born and going up and shading. When we age, this process is the cell lines inside the epidermis. They are not very lined and straight, and we get skin imperfections. So azelaic acid can get the skin cells in line like a younger skin. That's why it's very good also for acne patients, because also in the adolescence, cells are not in line and clog, and there are skin pores. They clog the pores for the same reason. So azelaic acid normalizes the skin cells turnover and the order shape of the cells. So this manifests in much nicer looking skin and younger looking skin. So azelaic acid will help with the balancing of the sebum secretion, with the texture of the skin. And also, I will remind, it is melanin suppressor and also anti-inflammatory. For this reason, we should combine the azelaic acid, the azopil, in the peelings for the summertime. So I advise to combine the azelaic acid in the hydroxy acid pills. Like, for example, if you use biopil glycolic or biopil lactic, it also depends on the amount of sun exposure. Biopil lactic is safer than biopil glycolic. But when we do, for example, 2 applications of biopil lactic, you can proceed to 1 or 2 applications of azopil on top of the biopil lactic. We begin with biopil lactic or glycolic. Always there will be the first application, the biopil glycolic or lactic, but then on top of them, you can do 1 or 2 applications of azopil, which is a very good synergy, because biopil glycolic maybe will irritate the skin, but azelaic acid is anti-inflammatory and melanin suppressor. So it will protect us from the those effects, right? Okay, when we're speaking about anti-aging and rejuvenation and pigmentation, it's important for us to add to the skin regimen of our client antioxidant and anti-inflammatories. That's because, as I said, the sun causes a spread of free radicals in the skin. Also, the sun causes inflammation, and inflammation and free radicals cause skin aging and pigmentation. We should add the antioxidant. We could add them by serum C serum, or by Prolift serum, or by Vita Plus serum, or by the ampule defense, if you remember the ampules. So you can give defense ampule to protect the skin, to combine it into ampulate cream and protect the skin from sun damage. Yes, I want to remind that the sun exposure amplifies all kinds of pigmentation, even pigmentation that are not related to the sun, like stress pigmentation, hormonal pigmentation. Let me speak a little bit about hormonal pigmentation and sun exposure. That's a very important thing for you to remember, and also to remind your client. When we have hormonal melasma, a client with hormonal melasma, when she's exposed to the sun, estrogen induces the production of MSH receptors. I will say it again. Estrogen raises the amount of the production of MSH receptors. MSH, melanos-stimulating hormone. The sun is causing MSH secretion, and also at the same time we have many MSH receptors, so it's amplified. That's why when we have hormonal melasmas with clients that are very exposed to the sun, we have to emphasize the use of melanin suppressors. For example, to use skin tone 3 times a day and not only 2 times a day. To use light cream, which is a moisturizing cream. To switch, for example, instead of bright using double pill, which contain melanin suppressor. Any way that you can find to change the protocol towards more melanin suppression will help us with all the hormonal melasmas with clients that are exposed to the sun. Also, for those same patients, you can add also sea serum as extra protection. I want to give you another advice for hormonal melasmas and also mixed pigmentation. Mixed pigmentation, I mean, there is pigmentation in the epidermis, but also in the dermis, right? So for melasmas and mixed pigmentation, I would advise to add to the regimen, to the treatments in the clinic, not home regimen, 1 or 2 at least treatments of microneedling, not peeling at the same visit. In this visit, only microneedling with a little short needle, like a 0.8 needle will be enough in the summertime. If we are in the winter, we can raise to 1.5 millimeter, but we speak in summertime, we can settle for a 0.48 needle. And this can help us and make the pigmentation treatment more effective and to treat the lower pigmentation. I will share with you a clinical study, one of many, by the way, about improving pigmentations and melasma by microneedling. So I will share 2 patients that got 2 microneedling treatments. At the treatment, they got only microneedling, no peeling and no other thing. And 2 treatments 30 days apart from each other. And this is an improvement in a very stubborn melasma. This patient and this patient. Okay, I will share with you some of the reasons that microneedling is good for hormonal pigmentation or mixed pigmentation. First, you can see this is a biopsy that can show us. You see A is the before and B is the after. You can see decrease in the melanin density in the deep layer of the skin, and also okay, thickening the dermis. That's a bonus. But I wanted to show another thing. And also okay, now I can change the slide more easily. In this slide, you can see repair of the damage to the basement membrane. And that's a thing I want to speak about, the basement membrane, and its relation to pigmentation, okay? So microneedling can repair damages to the basement membrane. You can see the before and the after. So I will explain how it happens. Many times, in most cases of melasma, we can see many melanosomes. Melanosomes are the vacuoles that inside there is the melanin granules. Okay, the melanocytes do not secrete melanin; they secrete melanosomes. Melanosomes are granules of melanin. We see in melasma many melanosomes on the basement membrane. It's not in the epidermis, it's not in the dermis, it's in between in the basement membrane, right? And that's very tough and hard to treat because peeling does not reach this layer of the skin. And also the melanin suppressors, the ingredients that suppress melanin, are not relevant because this is a fact. This is melanin in the basement membrane that is already formed. But microneedling destroys the basement membrane and the skin builds a new basement membrane, which contains, of course, no debris of melanin. And in this clinical study, by the way, those women had treatment with the Kligman, or if you call it the treatment combination, you call it the treatment combination with hydroquinone and tretinoin and hydrocortisone. In USA, they call it the triple combination. It's a prescription that those women were already treated for 3 to 5 years with this Kligman, and the treatment was stuck, no progress. The before picture was after treatment attempts that were not very successful, that there was a progress and then they were stuck with this condition. And in this stubborn condition, they got the microneedling treatment. But it should be emphasized that the microneedling was not the only treatment. They continued to use exfoliators and melanin suppressor while the microneedling treatments in between and before and after. So it's not enough to use only microneedling. You should continue using your products. So one of the reasons that microneedling is good for melasma and mixed pigmentation is one reason is that it fixes the skin barrier. So it contains less melanosome, but there are other reasons. When we fix the skin barrier, there will be no leakage into the epidermis of melanosomes. When the skin barrier is damaged, which happens in melasma and with a lot of sun exposure, this damage causes to the melanosome to leak to inside the dermis, So we stop this leakage and stop the dermal pigmentation. Improve the spread of melanin like the normal spread of melanin. It gets inside the cells and not in between the cells. Yes. Let's continue speaking on the rejuvenation and pigmentation in summertime. We all have, yeah.
We have a couple of questions in the chat.
Yeah, of course.
Related to what you just described. The first question is, which ampule was used for microneedling?
Okay, actually, BIOFOR ampules are not intended for to be used in microneedling. They are not for microneedling. They are to be combined in a cream and not to be applied directly on the skin. That's important because the ampules are raw materials. They are not products. They are 100%, and no active works in a 100%.
So what about the microneedling? What kind of ampules, or just the physical needling and nothing else?
Just the physical needling. Yeah, I know it's hard for you. Many doctors and many cosmetologists love to like inject or put some ampules while microneedling. It's not necessary. The outcome, you get the results from the needling, from the destruction of the skin and from the healing process. More question in the box?
Yes.
Yes, there is one more. So can we combine into one session azelaic and glycolic peeling?
Yeah, of course. Of course. And always the first application will be the glycolic or the lactic. And after, on top of it, we will put the azelaic.
Okay, thank you.
Yeah. More
questions? Oh, there's one more question. So yeah, no, one more. So what does the patient do at home after having experienced this microneedling session? What do they do at home?
Yeah, so mainly recovery. We should focus on recovery, and if the client tends to pigmentation or have pigmentation, so of course skin tone. So recovery, we should do it with the Skin Active. It's a perfect product for skin recovery. If needed, it should be used also calming, the calming mask. So Skin Active and calming. And if it tends to pigmentation, so skin tone.
One more clarification about the microneedling, the actual product or to be used or not. So does the doctor need any product to assure gliding of the microneedling, or just let the skin be dry?
No, if needed, I know sometimes the skin has to be more smooth in order to the device to
glide,
to go easily out. So yeah, they can apply, for example, the hyaluronic acid concentrate. You know, we have a hyaluronic acid, a raw material, and it can be used underneath the device.
Do I need to clean first application of glycolic before applying azopil?
Yeah, so no peeling should be cleaned or washed or neutralized. Those specific peels, you only apply them, leave them on for 5 minutes, and this is it. You shouldn't remove them.
Cool. I think we're done with the questions, so we can continue.
Okay. So I started to say that each one of us skin specialists have some clients that are very much exposed to the sun, and they want to keep it this way. So for those patients, we can go for the gentlest exfoliator like Lactofil Plus, which is the most gentlest one with melanin suppression. And even when the sun exposure is even much intensive, so we can use, it's not very effective, but we can use Dermapil. Dermapil is not limiting, no one of the client will be limited with Dermapil. Of course, we should use it in the night, not in the morning, but still Dermapil is a formula that goes with any amount of sun exposure. That's not really intensive anti-aging, of course, but it will give a little bit of refreshing to the skin. It's better than no rejuvenation at all. And because we want to continue rejuvenating our clients' skin on the summertime with all the limitations, we should put an emphasis on ingredients that can firm the skin without exfoliating. For example, biomimetic peptides. You know where to find them, in ProLift and in Skin Active and in the ampule, in edgeless ampule. Also, vitamin C can firm the skin. It induces collagen production. So vitamin C, Skin Active also contains Centella asiatica, which also induces collagen production, and Dunaliella alga. So all of those ingredients that can firm the skin without exfoliating, we should concentrate and give our clients. So let's have some tips about how to protect our clients that are getting peeling treatments in our clinic on the summertime. We want to do the peeling even with biopyrglycolic or lactic, but do them very safely. So let's review some tips. First one, as you can, it's not always possible, but try to direct the treatment to the evening or afternoon hours instead of the morning or the noon hours.
Yeah.
Make sure that the client doesn't do hair removal with the wax or other methods of hair removal just before the treatment or just after the treatment, because this is an irritation, and this in combination with peeling can cause inflammation. And of course, the more the client has tendency to pigmentation, the more we will keep her and give her before and after the peeling the use of skin tone. Even if she doesn't have pigmentation at this moment, but if she tends to pigmentation, or she's medium to dark skin, we should give her skin tone a week before and a week after the peeling treatment. Actually, we can apply skin tone or light cream even in the visit in the clinic after we finish the BIOFOR glycolic or lactic, whatever we did. And after the calming mask, we remove the calming mask, and we can put in the clinic a skin tone or light cream to protect the client. And also another tip, as I said before, but I will say it again, we can add at the end of the protocol 1 or 2 applications of Azopil. This is another protection. Yes, we also can space the treatment. Instead of once in 2 weeks, we can do it once in 3 or even once in 4 weeks, which is less stressful for the skin. Also, if we will combine antioxidant and anti-inflammatories in the skin regimen of this client, we will minimize the chances of evolving of pigmentation.
There are a couple of questions. Can we go with the questions now? Yeah.
Yeah, you have questions?
Are we allowed to combine microneedling and peeling for one session?
I strongly advise not to do it. It's too stressful, not only in the summertime, also in the winter. I don't love this mix. I know some cosmeticians and doctors do it, but this will compromise the microneedling and compromise the peeling, because when you do them apart, peeling in one visit and microneedling in another visit, it will be intensive microneedling and intensive peeling, which is good for the skin. But when you combine them, you should lower the intensity of the peeling and the microneedling. So I don't know, I don't see the logic. I prefer doing a very good peeling and a very good microneedling in separate visits. This could end, if you combine them, this could end with burns and pigmentation. And I saw many cases.
The next question is, so is the calming mask supposed to be rinsed off, or do we keep it on?
It depends in the clinic or for home use. I will answer the both options, actually. I can answer the both options. So if we use it in the clinic, of course, we put the mask in a generous layer for 15 minutes or 10 minutes, and then we take it off with a dry towel, right? And we take it off. We could leave some calming mask and massage it inside the skin, so it's not visible, but it continues working and calming the skin. This is for the clinic. And for the home use, we put it on the skin and we leave it like as much as we can. The more the better, because you know we get more relaxation and recovery of the skin. Even the client could go to sleep with calming, or when he wants to go sleep, he can remove most of the calming and the remains to massage into the skin and go to sleep. So it's very important, especially in the summertime. Some of our clients buy other products, not from us, but from the internet. They buy it online. Sometimes it's very active products with acids, with retinol, even with TCA. I saw products even with TCA. And they use those products. Not always they share what they do at home and what they bought and what they apply. On the summertime, when we do a rejuvenation treatment, everything that our client has at home is our business. And we should know it, and we should know and be aware of all the skin regimen, and we will actually organize this skin regimen. And if needed, we should say to a certain client, this cream that you bought outside, put it aside. It's not, it doesn't go with my peeling or with the treatment that I give you, or put it aside for a week and then come back. But we should know about all of the products and the procedures. Maybe they do procedure outside, I don't know, injections or other treatments. All of the things we have to monitor the products and the treatment and the hair removal and everything that the client does in the summertime. Yeah, the client doesn't always understand the reason. We ask and we inquire and we intervene. So we should explain the logic, and we should explain how dangerous is it for her to apply other creams without informing us. Now, sometimes we have incidents like we did the peeling. We gave all of the security instructions for the client, and still she was exposed to the sun, and there is a burn. And burn turns to pigmentation. So as soon as we know about this incident, if there's a burn, we should refer our client to a cream with the hydrocortisone, which is the most effective ingredient to stop inflammation and return the skin back to normal. More than calming, more than any cosmetic ingredients, hydrocortisone will stop the process of the inflammation that turns to pigmentation. Okay, for to be used 5 to 7 days until it's recovered. So I want to share your case studies, but before I will share them and we'll discuss how to treat those patients, I will want to summarize that even in summertime, each and every client can get a proper treatment for rejuvenation and for pigmentation. We shouldn't stop treating. We have a variety of exfoliants from Renew, which is very limited on the summertime, to Lactofil Plus, which is the most gentlest product, including melanin suppression, that we can safely use in the summertime. And each and every client, after we know his amount of sun exposure, we inquire, we get to know him, and we can adapt the correct protocol for him to be safe, but still look nice. So this is Soft and Clean. This is a plumping gel for us to use when extracting comedones and doing the cleansing of the skin. That's the product. I will use, we say in Hebrew, spatula or spatula. So we apply on the skin, not on the hand, of course, on the face skin, a generous layer. We leave it on for 1 or 2 minutes, and then we massage it deep into the skin. Massage it deep into the skin. When we do it, you will feel that it heats. You will feel the heat, okay? Which is normal, that's the product. It will be heated and the skin will be heated, okay? It's very important to massage it into the skin because just applying is not enough. You will feel the heat even if you just apply, but if you will massage it, you will feel the heat better. We do the massage because our skin is far from being smooth. It is not smooth. We have many pores and little cracks in the skin that the product should get inside and soften the skin. And after the skin is soft enough, you will feel it. Then you can do the extraction, the classic, clinic of the skin. And this is it. It's from the field from cosmetician. I hear this is effective product. And also nice smell, by the way. It smells nice. So let's share the screen and look at some case studies. This one. Age 41, patient on hormonal therapy. The doctor has selected, I cannot say, selected a
regimen.
Inflammatory element have decreased, pigmentation remains.
So there were acne also, so the acne has gone and the pigmentation still remains.
Okay, so she had acne, and but as I said, the pigmentation is more like hormonal pigmentation. Am I right?
Yes.
Yes. Okay. So, and what did she give the client so far? What was the protocol so far?
So what was used was peeling, and so anti-traumatic cleaning. So it was delicate cleaning and peeling combined.
Which peeling? As a like peel?
Yes, as a like.
Okay, and for home use?
So it was the products for home use for oily skin.
BIOFOR products, what are the ingredients?
Okay, so while we're waiting for the reply from that person, there's another question that we can, to optimize our time. So it is a question about the soft and clean gel. Are we supposed to put film on top of the gel to improve absorption?
You can do it. You don't necessarily have to, but this can improve a little bit. While she's writing the answers, maybe I will add some points. Okay. So first, as you see, I emphasize some spots of hypopigmentation. These clients have tendency also to hypopigmentation. And whenever we meet a client with tendency to hyperpigmentation, we should emphasize that over the treatment, when we will get improvement in the pigmentation, the hypopigmentation will be more prominent, maybe, because we remove the dark areas, we improve the dark areas, so it's more dominant, the bright areas, the fair skin in the hypopigmentation areas that I highlighted those areas. She has more, not only those that I marked there, but this is very important to set expectation to introduce to the patient this tendency. Maybe she didn't notice, maybe she did, maybe she doesn't know the consequences, but she has a tendency to hypopigmentation. It's not because of the treatment that we gave her, it's a genetic tendency. Maybe the hormones are also related from the hormonal therapy. So the client should know about it and should know that this will be maybe more visible after the pigmentation treatment. This is one point. Okay, another thing, as I said before, little microneedling with the 0.8 or 1 millimeter. These women have a thick skin, so she can use 1 millimeter of microneedling, can improve the melasma. She has melasma, maybe even a stubborn melasma, and the client should get treatment with the 0.8 to 1 millimeter microneedling. Of course, 3 times a day, I would advise 3 times a day to use skin tone. If she could get light cream, also this is advisable. And another tip to enhance the melanin suppression is to use AzoCare on the same evening when we use the exfoliant. So if this client should get an exfoliant according to the sun exposure, whether it's bright or lactophyll or maybe lactophyll plus, if she's exposed intensively to the sun. But in addition to the exfoliant, she can apply every day AzoCare. AzoCare will do 2 things. One, control the acne tendency, which she still have acne tendency. And second, it's a melanin suppression. In this client, we should emphasize the melanin suppression because of the hormonal component in her skin.
We have an answer on which product she used to treat this patient before. This was not a BIOFOR product. This was the product was liposomal zinc and within with active ingredients.
I missed the active ingredients. What was inside the product?
Liposomal zinc.
Okay.
And glycine.
And glycine.
Glycine, yes.
So it's not, it's not enough to treat pigmentation. Actually, it cannot really treat pigmentation, those ingredients. So she can still use them as like moisturizers or recovery, but she didn't have really pigmentation ingredients that can improve this pigmentation. So if we will speak about evening regimen, face cleaning, washing the face with soapless soap, applying exfoliator according to the amount of sun exposure, then applying azo care, and then applying skin tone. This is the evening routine. Okay, and for the morning, she could apply skin tone and also, if needed, a light cream, which is more melanin suppression. By the way, the combination of microneedling and exfoliator will also improve the large pores that she have. When doing microneedling, she should be careful with the remains of the acne she have. In the forehead, she has still remains of the acne. So I don't know how much the forehead is active or the acne is controlled. It's not 100% in control with the acne. I can see remains. So she should be very careful with the device, with the microneedling, to not cause exacerbation of the acne. Yeah, this area, yeah. So okay, I meant these areas. And of course, the azo care will help us in two things, in the pigmentation and with the acne control.
We have a few questions that let me read you briefly before we continue.
Yeah.
Do we need to clean off the cleaning gel before extraction? The softening clean gel. Yeah.
Yeah, you should, because it's sticky. You should remove it.
How long do you recommend to keep the gel under the film?
To put it under the film, you can do it between 1 to 2 minutes. It will be enough.
Do you recommend, or are we allowed to put an anesthetic, lidocaine-based anesthetic under this soft and clean gel?
Under the soft and clean. So first you put lidocaine and then the plumping gel.
Yes.
What's the purpose? You want to do what? What treatment?
Maybe so that it blocks this heating sensation. Maybe the patient is too sensitive.
It's not so hot. It's not really hot. No, you don't need it.
So there was another question about this soft and clean gel. Do you recommend its use for teenagers, teenage skin?
Yeah, why not? Whenever you want to extract in an easier manner, so you can use it.
Also, if you can see the group chat, the conversation, there are a few pictures, a few images and text.
Yeah, of course. So what do you say? Maybe we will review the case studies that we have there, because we have some more case studies.
Let's finish.
And then
yes.
And then continue to the chat box. So we have with this picture, I got no details like the age and how old is the pigmentation. I have no details for this case. Actually, what did she get? So if the participant is with us, the doctor that gave us this picture, I would love to hear some details about all the data of the pigmentation. And also for this case, so two cases. One is this case, which it's an easy case, but maybe if I will hear the data, there are some special data for this back. Otherwise, it's easy.
Okay, I think we have the information regarding these two. Let me scroll down. Oh no, those are new.
Okay, so let's move on to this girl, which I got here the little story. She's 21 years old, patient, using topical therapy, and now has been switched to systemic therapy. I assume that systemic therapy is a acne pill, is a Roacutan. So she was using a topical. She's now to systemic therapy. So did the doctor mean that she is getting the pill Roacutan? She's getting Roacutan these days?
Yes, Roacutan. It's true.
Okay.
This is
So, so the question was when this patient will finish the course of Roacutan, what do we do to prevent pigmentation? She said treat pigmentation, although it's, yeah, she has a little bit of pigmentation. Okay, she has a little tendency to pigmentation. We can see on the chin area a little bit of darkening of the skin. So we have to remember, of course, that after Roacutan, the skin is very sensitive to exfoliants, and we should treat the skin very, very carefully. So let's assume that all the acne is gone after the Roacutan therapy, which not always this is the case. You know, sometimes the Roacutan course is finished, but the acne is still here. But if it will be finished and the inflammation will be finished because she have a little bit of inflammation, we can start using a light cream and skin tone, and we should let the skin recover for like at least 2 months. So after 2 months on calm skin, not ready skin, not sensitive, not irritated skin, assuming that the skin is calm, after 2 months after Roacutan, we can start using Lactofil Plus. We use Lactofil Plus because the skin is very sensitive after the use of Roacutan. And when we start it 2 months after the finish of the course, we won't use it every day, but we will start twice a week. And then after 2 weeks, we should use it 4 times a week. And then if everything is okay, no sensitivity, no redness, no irritation, we can progress to we could try to use it every day. Okay. Okay. And when the Lactofil Plus will be, so the skin regimen will be, if we go like 3-4 months from the Roacutan, the skin regimen will be using Lactofil Plus and skin tone and light cream. When the Lactofil Plus will be finished, we can consider upgrading to a double pill, which will give us a better exfoliation. Okay, skin is now more relaxed, more recovered, so we can switch to double pill and skin tone. By the way, if the skin will still be unbalanced after the Roacutan, we can consider using AzoCare, which is a quite gentle product. It will not irritate the skin, but will give us some balance to the acne. And AzoCare can be used even in the same evening with Lactofil Plus. You don't have to switch one evening for AzoCare and one evening for Lactofil Plus. Also, once in a month, you can try peeling Azopil at the clinic. This can be a contribution to balance the acne skin and also to contribute to the pigmentation because it's a processed melanin.
Can we please go back to one of the earliest slides with the pigmentation around the eyes? So the story is over the last...
this one?
Yes.
Yes. So it's this one.
Okay.
So this person has pigmentation all of her life. So over the last 2.5 months, she was using carboxy to produce this lightening effect, and also meso white as in a form of mesotherapy, a lightening booster through phonophorese, and also alginate masks for lightening and brightening, and also some home care products.
Can you repeat? I wrote down phonoporesis, alginate mask for brightening. Before that, she was using...
Yes, carboxy something, carboxy.
Carboxy is what? It's a professional pill? Actually, you're looking for you're waiting for the answer for the carboxy. I think there is a carboxy pill for the clinic. I heard of it. I don't know if this is the same treatment. And she's exposed a lot to the sun, it looks like.
Yes, it is correct.
Yeah, she's exposed to the sun.
Mm-hmm.
Okay, so as you can understand, when we will build a treatment protocol, she have to cooperate with us, with the doctor, and to minimize the sun exposure, because otherwise we cannot treat. I asked because I see a lot of sun damage, and also this woman have tendency to hypopigmentation, not just hyperpigmentation, but also a hypopigmentation. Maybe I will put it in other color. Hypopigmentation, for example, this area. So there is a chance that the orange areas, that the spots are partially dermal pigmentation, which will be very tough to treat, and not a complete outcome, not a complete, like we can have a little bit of lightening of those spots, but not complete lightening. Maybe if the doctor have IPL device, she can have better results with those areas that I marked in the orange. And also when we will start to get results, the white areas, the hypopigmentation will be more visible. This is the thing that the client should know. Okay? That's important thing to set expectations with clients. Sometimes cosmeticians or doctor neglect all those hypopigmentation areas. They don't see, but the client afterwards complains, I got hypopigmentation from or white areas on my face after your treatment. So some of the pigmentation is deeper on the skin, some is in the dermis, some in the basal layer, and some in the epidermis. So we will get improvement, not necessarily clearance of all of the pigmentation, we should say, and we should set expectation. I look at all of the face, you said the pigmentation under the eye, but it's not only under the eye area, but all over the face, of course. So let's speak a little bit about the protocol. If we were in the winter time, I would suggest using Renew all over the face and twice a day skin tone. And the eye area to use Lactofil Plus on the on the lower eyelid. Lactofil Plus can be applied even on the lower eyelids. The other exfoliants cannot be applied not in the upper eyelids or the lower eyelids, but Lactofil Plus is the gentlest, so it could be applied there to address the under eye pigmentation. Now, because we are in the summertime, we cannot use Renew because, you know, it's photosensitive. So for the eye area, we could use Lactofil Plus without any concern. This is a gentle exfoliator. For the other parts of the face, we should use stronger exfoliant. So this will be chosen according to the sun exposure. So the doctor should ask the client about the sun exposure. And when we when we get the minimum sun exposure the client could give us, we should choose the best exfoliant to use on the other parts of the skin. Every evening, every other day, it depends also in the sun exposure. Skin tone would be used 2 to 3 times a day. And at the clinic, at the office, the doctor can use the BioPil glycolic, which is a better peeling than BioPil lactic, and he can accentuate with applicator on the very dark spots, here and here and here, everywhere. When we see a very dark spots, we can apply first the general application all over the face, and then we can dip an applicator inside the mixed bowl with the peeling. We can dip the applicator and put the peeling. I should switch the color, and put the peeling with the applicator on the very dark areas, like I'm not doing it so well. Like we want to erase it. I want to skip the. So we spoke about the clinic, we spoke about home regimen. Later on, when we get better skin, maybe in the winter, she could use some treatment of microneedling. This will also help because some of the pigmentation is dermal pigmentation or like basal membrane pigmentation.
Next slide, 63, about back.
So this patient here is 21 years old. So the doctor prescribed Rocaton, so this is the state as of now, I believe.
So she finished the course of the Roacutan?
So actually, no, she hasn't finished the course yet. So the protocol was 5 days to take a pill every day, and then one tablet per week. And also she was prescribed a cleaning solution and some sort of cream.
So these days she takes only one pill per day?
One pill a day.
One pill a day. Is it full dose or 20 milligram, 10 milligram?
20.
Okay. I asked this question because when we are in a full treatment, the skin all over the body is very sensitive. So we have to be cautious. But when we have the small dose, like 10 or 20 milligram and once a week, the sensitivity is behind us. So last question for the doctor, how long is she taking only once a week, 20 milligram?
Okay, so once again, the treatment is Roacutan 5 days every day, 20 milligrams, right? And then after the 5 days are through, one tablet, 20 milligrams every week, but we don't know how many weeks. The client didn't say, no.
Okay, okay, all right. So the treatment of 20 milligram once a week is not intensive. Also, when she took 5 days, but 20 milligram, it's not an intensive treatment. So I assume that the skin on the face and all over the body is not so sensitive, and we can treat her like a regular treatment. So I advise only for like extra precautions to take Azalite Plus and not Azalite. Azalite is irritating product, and this girl specifically seems to be a little bit of delicate skin. So if I didn't have the picture, I would advise, like not this girl, I would advise Izolite on the back area because the back area is a thick skin, not sensitive skin. But this girl specifically seems a little bit more sensitive. So I will, for extra precautions, take Azolite Plus for all over the affected area, like applying it, I will draw it. Because she have also like unbalanced area and a little bit of pigmentation also. So all over the affected areas or the active area, she will apply daily, every evening, Azolite Plus in a generous layer. And later on, when the skin will be more balanced and smooth, we can switch. If she still will have pigmentation, we can switch to exfoliator like Bright and on top skin tone. If she will be bothered with the pigmentation, I don't know, maybe she isn't. Yeah, maybe she will need, while the treatment, while the acne treatment, some moisturizing cream because the skin looks a little bit dehydrated. So we can add the cure on top of the Azalite Plus. We have another case with the interesting case with the leg. This one.
Mhm.
I assume she spends a lot of time outdoors in the sun.
Yes, this is so. So the person spends time in the sun, and also this pigmentation appeared after she was done. She experienced a laser epilation, so after laser treatment.
Okay, okay. And before the laser, she didn't have any pigmentation on the legs?
No, so she didn't experience this kind of pigmentation before the laser.
Okay. This is a big epilation. It's a big area, treatment area for epilation. Okay. I wouldn't do epilation on the legs, by the way, but it's done. So we have to set expectations in this case because epilation is a deep treatment. The pigmentation may partially be deep pigmentation, okay? So we can improve it, but I don't know if I can promise clearance. So I would advise, and she should be careful from sun exposure while treatment. If she cannot, so we should do the treatment in the winter time. I don't know, in the summertime, our patient want to go to the beach or to the swimming pool, so it's very hard to cover the legs. So if she cannot cooperate in the summertime, we should give her only a skin tone to be used twice a day, two separate times a day. It's a very large treatment area, so it would be also expensive. She should be aware of it. And when she would be less exposed to the sun, like very not exposed to the sun, we can try an exfoliator on the darkened area. She's not dark skin, so she could use Bright, she could use Renew, she could use any exfoliator, and on top of it skin tone. But this is only in case she can keep from sun exposure. Otherwise, she should use only skin tone, and in the winter, she would use the exfoliator. I see another case here.
Yes, melasma for many years. She was on hydroquinone, but it didn't lighten completely. After pregnancy, the pigmentation reappeared. Currently, only using tyrosinase inhibitors.
Can you say it from the beginning? She is?
Yes, so she has melasma for many years. She was taking hydroquinone, but it didn't lighten completely. After pregnancy, the pigmentation reappeared. Currently, she is using tyrosinase inhibitors.
Also hydroquinone or some other ingredients?
Okay, so before pregnancy, she was taking 4% hydroquinone and SPF. And then after pregnancy, she is now taking 2% hydroquinone and tyrosinase inhibitors in some other form.
And is there exfoliator in the regimen?
So this is the protocol that we were given. So most probably there is no exfoliator in the regimen.
Yeah, perfect. So in each and every pigmentation treatment, we should have exfoliator. We cannot settle for only melanin suppression because this is not enough. When we're stuck with the pigmentation, you know, the exfoliators will remove the existing pigmentation, and melanin suppressor will treat, let's call it the future spot, the spot that is not already formed, which is very good, but we should deal with the existing pigmentation, so we cannot skip it. So we have to choose a good exfoliator, the best exfoliator that we can in this season give to this client, because you know we are in the summertime, but still we should see what is the sun exposure and give the best exfoliation in the best or in the most intensive protocol that we can. Now, about hydroquinone and melanin suppressors, I assume that it's a medical product or another product. we can try and switch, put aside the hydroquinone product and try skin tone, not because hydroquinone is not good, but sometimes the skin reacts to hydroquinone with, we call it rebound pigmentation. Rebound pigmentation, it's a known phenomena that first we get results with hydroquinone, and then it comes back big time. So if you're speaking about home regimen, I would advise a strong exfoliator to be used as many as she can this season. And on top of it, skin tone 2 or 3 times a day. Also, you know, hormonal pigmentation responds very good to azelaic acid. So I would advise under the skin tone to put Azocare or Azalite Plus. So it's first the exfoliator, then Azocare or Azalite Plus, and then skin tone. That's for the evening. For the morning, only skin tone. And for the clinic, I advise to do, of course, to the extent it is possible, you know. If she's exposed to the sun, maybe not so much, but peeling, professional peel with biopeel glycolic or biopeel lactic. And on top of them, to put azopil, which will give another contribution to the pigmentation. Yeah, also you can emphasize with the gas pad on the forehead, on the more darkened areas, like maybe I will skip the sharing and show you. Okay, in the forehead, she has areas with more pigmentation. So she can take, let's say that this is a gas pad, okay? So with the gas pad, after she does the general application, she will put some more peeling and emphasize on the area that she have more pigmentation, okay? Like pressing, like, you know, and the peeling will be done once in a month or once in a month and a half at the clinic. Okay, maybe in the winter, I would advise also to do some micro needling. Yeah, it will not replace the regular treatment, but it can contribute a little bit. Exposure to the sun, because melasma in the sun, as I said, are not good friends. So you can see how irritated is the skin, very irritated, very sensitive. And that's why I advise to stop using the mandelic acid, because mandelic acid peel is still peeling, and this skin does not need any peeling these days. Like anyone, any peeling, and no matter what kind of acid, okay?
Okay, so there is a clarification that the mandelic acid product was not a peeling product, it was more like a serum. But does
Yeah,
it
but
still,
what's the concentration? It's still mandelic acid, it's still hydroxy acids. I know it's a gentle acid, but it depends on the concentration. What concentration was the serum?
So it was 8%.
It's like it's borderly, you know. I still think she should skip these days from the mandelic acid. She can go back to the mandelic after the inflammation will look better.
And also this client, she has been using niacinamide serum as well.
That's a good ingredient. Niacinamide is a good ingredient. So she can, but how many products is she applying? You know, you should not over apply.
Oh, actually, so the clarification is that it is in the same serum. So it's this serum contains both mandelic acid and niacinamide.
Niacinamide. Okay. I see. But you know, if she's getting cure is also niacinamide, 5% niacinamide. So she won't be missing these ingredients. So for the morning routine, she will wash the face with the soapless soap. Gently tap the skin with the towel, not to press the towel, not to rub the skin. It's important. And then apply a cure all over the face. And sun protection when she goes out. When she's at home, she should put calming after, of course, Azocare, but she should put after Azocare and cure, she should put calming and stay with it several hours. The more the better. If she could go to sleep with calming or with a little bit calming, it would help, because as long as she have this inflammation, we should put an emphasis of calming the skin.